Good morning, Chief. Good morning, my fellow interns. Good morning, my fellow students. My name is Shalom Okocha. I am a 500 level student of Medical Rehabilitation at University of Kofi and Limi campus. My topic is Physiotherapy Management of Constipation. So, looking at the word constipation, constipation is an unsatisfactory defecation caused by infrequent stools and irritable bowel movements. Looking at the types, we have the acute and we have the chronic. Acute is what, like a rapid onset, and then chronic is more than 3 months. Then looking at the etiology, causes, it can be due to pelvic floor dysfunction, that is the ability of the pelvic floor muscles not being able to coordinate very well. And then looking at the primary causes, primary cause is the pelvic floor dysfunction. Then secondary causes under low fiber intake, not taking water regularly, and low fiber intake, like as we all know that most people do take oranges for constipation, and you tend to take orange so that it will loosen up your stool. And then not taking water. Imagine taking food and you are not taking water for easy digestion. Yes. Then for the pathophysiology, we have reduced erectile dysfunction, we have pelvic floor dyssynergia, that is ability of the pelvic floor muscles not being able to coordinate very well. Then the epidemiology, it affects 12% to 19% of the population in North America. Then risk factors, we have age. Age is due to older adults not being able to take water, and then their diet, their diet is not really balanced. And then looking at the gender, is more in women than men due to hormonal factors. Then lifestyle, no physical activities, that is staying in one place, more of a sedentary lifestyle, because you know that physical activities helps in exercise, it helps you move your body, and it helps in digestion, not like taking food and then you are just in one place. Then for the symptoms, we have infrequent bowel movements, bloating, then abdominal hard stools. Then looking at the diagnosis, we have colonoscopy, that is indicating red flag in the stool. Then we have anorectal mammorectomy, that is muscle coordination of the to assess the muscle coordination of the rectum and the anus. Then for the complications, we have hemorrhoids. We have hemorrhoids, that is swollen vessels caused by straining. Then we have anal fissures, that is opening the anus due to